Yes, we are live. We are live on Facebook. Um, and good afternoon, everyone. Well, good evening. Just checking to ensure that we are being seen and heard. Yes, we are being
Hello.
seen and heard. I can't see. Okay. Are we being seen? Okay, great. Thank you. Okay, so lovely guys. Dr. Jackman, we are live on Facebook.
Hi, everyone.
For some, right. For some reason, it's on my end, it's frozen, but we are not frozen. We are being seen and heard clearly. All right. So, good evening, Dr. Jackman, and welcome to Women Who Roar. And it's a production of La Femme Boutique. And now we are live with La Femme. And Dr. Jackman is a Trinidadian living in the US. Correct, Dr. Jackman?
Yes, it is.
All right, lovely. Can you indicate what part of Trinidad and Tobago you're from, please?
I hail from the south. I'm from originally
Woo!
from Marbella.
Whoop, whoop. Didn't even know. I was hoping you said that.
Yes.
Lovely, lovely. So, guys, Dr. Jackman would have sent me a very impressive res, bio. And so I got some really good information about her, her credentials, outstanding. And this evening, we are getting to know a woman who rose. And why am I considering Dr. Jackman a woman who I believe rose in terms of our conversation about women who roar is because of her work. She works with women, women who, find themselves in challenging positions in life, who probably never thought they would have been there. And I saw her on Instagram actually, and I was really impressed by the information she was sharing. And so I decided I actually came up with the idea for Women Who Row, I said I'm going to ask her to come on, and I'm so happy that she graciously said yes. And Dr. Jackman, your credentials would say that you studied in at UWE, and then you would have left to pursue your career abroad. But I want to know about your journey into medicine.
What led me into medicine? I
Yes.
always had a passion for biology in school, in
Mm-hmm.
secondary school. And it's
Mm-hmm.
funny because growing up, I had two careers that I always wanted to do. One was a
Okay.
doctor, and the other was a cashier because I always liked to hear the ching and see it open on TV.
Lovely. Lovely. Lovely.
At
Understood.
least I got to accomplish one of them for now. So
Very good.
at a tender age of 2 years old, I don't know if you can see it well on the camera here. I have a scar going across my face. Um,
Okay.
and that's because at 2 years old, I decided to use the rocking chair as a chair to climb up and give me height to see outside. And
Mm-hmm.
that literally capsized. It broke into a vase, and the vase was a glass vase. So it literally
Ooh.
tore into my face, cut into my face.
Mm-hmm.
And basically, the amount of blood I lost and how critical it was at the time, I could have potentially lost my life. So I grew up
Okay.
knowing that a doctor had saved me. And what could have potentially ended very tragically, didn't, because, someone was there to, scoop up this 2 year old and take her to the OR quickly and, fix, my bleeding
Oh.
face. So that was always my inspiration.
Mm-hmm.
I had wonderful interactions with doctors. My family practitioner in Trinidad is Dr. Chomley. If you're from South, you may not know the
My
Chomleys.
doctor as well.
Yes. So I've always had great interaction with the
Mm-hmm.
Chomleys. I worked with Stacey Chomley, that's his, the niece,
Mm-hmm.
because she was on the Trinidad and Tobago Medical Association. So I was always kind of geared towards pursuing medicine, and I love biology. I love science. So it even made it stronger. So that's what really got me into the mind frame was my incident at 2 years old reinforced
Wow.
my pleasant experience throughout my life with the doctor. And throughout my life, besides that incident, the only doctor I really encountered would have been Dr. Chomley, because I never had any major other problems that
Right.
need hospitalization. So that was my main
Excellent.
motivation.
Okay, excellent. And so you decided that this is the area that you would like to focus on. This is your life's purpose, your career. And why then did you move on? Did you specialize in the field that you did?
Okay, so OBGYN came in med
Hmm.
school. To be honest, as a child and with the dream of being a doctor, I never really knew that there were different types of doctors. In my head, a doctor was a doctor. So you,
Hmm.
you had
Right.
needed surgery, you had, diabetes, you needed brain surgery. It doesn't matter. A doctor is the person who you'll go to, right? So it's
Hmm.
only in med school, honestly, I would be particularly honest. Only in med school, I think it was really clear the differentiation of the different types of doctors there were. And I realized early on when I started my clinical rotations, meaning that we're actually going to the hospitals now, I realized early on that I liked surgical field in one way or form. I like to use my hands. I like to be in the operating theater, but I also like to think. And I think OBGYN gives like a perfect balance to that. At one point in time, I thought I would have been a pediatrician, because everyone who knows me knows I love children, like really, really love children, especially babies. Um, but then I had some experience working in children hospital. I mean, they would be sick, obviously. So it was a bit sad for me
Right.
seeing children in that state. I did work, I did rotate in Mount Hope, where, you did see patients, children with cancer. Some of them died, and I really couldn't take that emotionally. So I realized that
Okay.
I love children, but, I love to see them healthy and playful and
Of
happy.
course.
And I thought that OBGYN, I actually still kind of get best of both worlds. I get to do surgery, but sometimes it ends in like a baby if I'm doing obstetric surgery,
Right.
cesarean section. I get a little happy bouncy baby out of that. So
Hmm.
I really kind of gravitated towards that field. And then my mentor back in Trinidad, Professor Basawa, followed by Dr. Minto Bain, who's an
Hmm.
REI doctor in Trinidad.
Hmm.
They really inspired me and encouraged me. And, I guess too, in med school, it kind of follows sometimes that if you like the doctor you're working with, you kind of automatically like the field as well.
Right. Right.
So that's what moved me towards OBGYN. And right now I'm in the phase of where I'm actually trying to focus more on reproductive health.
Okay.
And what kind of focused me into that niche is because same thing that I said, I love children, I love family. One day I anticipated that I would have a family, and I came from a large family. I
Hmm.
have it's five of us in total, five siblings in total.
Hmm.
So the ability to provide a family for people who are unable to conceive naturally on their own is something that I think is very precious. It's a privilege to help people meet their family goals, so their
Yes.
reproductive goals. So that's what's leading me down to this new path that I'm not yet fully completed in my training, but that's where I'm heading.
Excellent. Excellent. And so there may be young ladies looking on, maybe gentlemen as well, and they are considering getting into this field. What would you say to someone? Sometimes people, you are attending a secondary school, and sometimes you believe it's something so far out of your reach.
Right.
It's for some people, not necessarily for you, even though you have that dream or that desire. What would you say to such a person?
Well, I'm a firm believer of pursuing your dreams and
Okay.
believing in yourself first and foremost. I am also a firm believer of the power of positive thinking.
Yeah.
So I think if you really want something and you really think that you should have it and you will get it, you will get it. And God forbid if you don't, it means that something better is on its way. But it doesn't mean that you should give up. So I'm somebody very persistent. All my friends, anyone who knows me knows that I'm extremely persistent. And there were times where things seem shaky, not so much in Trinidad I would say, but more like in the US front of getting my
Okay.
residency specialty,
Hmm.
where because I was an international graduate, I had no exposure or experience at the point in time. The surgical fields are not advised for people under that umbrella. Medicine is
Okay.
like an easier route. So I was advised several times in the US to pursue internal medicine or something that will give you like a higher chance of matching. Because in the US, you have to apply and they would have to like you back, and you have to go to interviews and you have to do what it's called a match. So basically, you have to get in. So a lot
Okay.
of people were like, you have much better chance, and you do have much better chance of doing like a medical field without the surgery, because surgery is very competitive. So surgical fields include general surgery, but OBGYN also comes under it. So you would
Right.
have the naysayers, but I knew what I wanted to do. And I pursued it with all my heart. And I mean, I did match, thankfully, but even if I hadn't, I would have just pursued it the following year. If you give up too easily, you wouldn't get your dream. Sometimes you have to work a little bit hard, but it makes the reward so much sweeter in the end. So anyone out there thinking that they want to pursue this, one, you can pursue it in Trinidad. The reason I didn't opt for that is because I wanted to move on to reproductive health, and we don't
Okay.
have that aspect in Trinidad. So it's just much easier to transition everything into the US system or the UK.
Right.
And I chose the US. And so one, if you have a passion, you can pursue it with all your heart. And if you know that you deserve it and you want it, work hard. You don't succeed the first time, work hard on it again. We all have our little stumbling blocks. I wouldn't call it failures, our little stumbling blocks. Get up, brush yourself off, and figure out why you stumbled in the first place and try again. So you can do it, okay?
Excellent advice. Very good. So, Dr. Jackson, there are some ladies on. I'm seeing Nicole Lake is on. Good evening. Good
Hi, Nicole.
evening. There's a Larissa Johnson. She says that good evening. She's from Tulsa
Ah.
in the US. I'm seeing Safia is on. I'm seeing Roxanne Sylvester. We have a few ladies well on the live. Safia says, I admire the success mindset. Dr. Jackman, sorry.
Yeah,
So
I'm the man, not the
she
son.
says, okay, lovely. So, Dr. Jackman, we are here now. You have given us your background. We understand who you are a bit. We know you're from Marabella,
Yes.
Trinidad and Tobago, and you would have gone on to the US to further your scope, broaden your horizons because you're moving on to another field,
Yes,
as you said, right?
that is correct.
Right. So the women are on now and they want to know. I'm seeing there's a Gayatri. I hope I'm pronouncing the name properly on. My sister Quema is on all the way from Dubai, Dr. Jackman.
Ooh, I love
Yes.
Dubai.
Me too. Stacy is on. Stacy says, good evening, everyone.
Hi
All
everybody.
right. Stacy is my cousin and she also works at the boutique. So she's on as well. And these women are on and women have so many we have complex bodies, I
Mhm.
believe, and there are certain issues that we face that men wouldn't face, of course. So when the whole idea of reproductive health comes to mind, what is it really about?
Reproductive health is totally encompassing, not just me wanting to have a baby, which everybody just thinks about it at their point in time, but basically everything encompassed,
Mm-hmm.
even in not having a baby. So, family planning, which could mean that I want to get pregnant or I don't want to get pregnant, knowing your options, knowing your choices, and knowing where you stand is all
Right.
encompassing in reproductive health. Okay, so anything to do with the female reproductive system, basically, right?
Mm-hmm.
So basically, my goal as an OBGYN is to make sure that women know their rights as well as know their options, and then know what could go wrong and what is right. A lot of times we don't even know what's going wrong, so we don't even know who we should seek advice to,
Okay.
which is actually one of the reasons I started my Instagram page back in December. Well, December I wasn't really
Mm-hmm.
active. I really started getting into it, I think, like around February or March this year. But the reason I
Okay.
started my page is because throughout my residency, which is training to become an OBGYN, I
Mm-hmm.
worked with an underserved community in Brooklyn, and I realized how sometimes they were completely uninformed of decisions of
Mm-hmm.
um, things that they were doing, they were agreeing to. So they were signing the consent to have their tubes removed or to have this procedure or fibroid removal, which is good. if
Mm-hmm.
you know the consequences of this. And some of
Right.
them wouldn't have significant consequences, but others of them had consequences that could affect their future fertility.
Mm-hmm.
And a lot of people weren't understanding what they were giving consent to. So to be
Wow.
honest, under the definition of consent, it really wasn't consent, but it's what a lot of people get, right? So I
Mm-hmm.
decided that I will take the time to put out educational videos and information in general to reach as many women as possible, because it's your right to know. You should be knowing what you're doing, what you're signing for, because healthcare now is more or less like another commodity you're buying into.
Mm-hmm.
And if it's anything, it's the most important commodity you should buy into. So it's one place where you should know all the specs. You're going to buy a laptop, you're going to know everything the laptop could do. Don't agree to a surgery and you have no clue what's going on or what happened in the end. So
Good.
I always try to encourage people to take charge of their reproductive health. And this is where I decided I'll come in. Apart from just being a doctor and seeing the patients that I know personally, I wanted
Good.
to have a greater reach and reach people who I also don't know, who may not ever see me personally, but
Right.
the information will benefit them in one way or the other. At least I hope it
Lovely.
does.
Lovely. It certainly does, Dr. Jackman. And women, there are several issues reproductively that women may have in terms of the reproductive health.
Yes.
There's the endometriosis, sorry if I'm pronouncing it incorrectly,
Endometriosis, yes.
right? Ovarian cancer. What are some of the ways that we can prevent? Is there prevention? How could it be prevented?
So one of the most common things we could prevent with respect to reproductive health is cervical cancer. More than ovarian cancer is cervical cancer.
Okay.
And the testing that we have for that is the Pap smear. It's actually a papinicula. That word is just too long, so we call it the Pap smear. And this test screens the cells at the mouth of the uterus called the cervix.
Mm-hmm.
And we easily access the cervix through the vagina with a little uncomfortable instrument called the speculum. So we could look at the cervix, look to see how it looks, and then we also take this pap smear that we send off to a lab, and they're able to tell us, is it completely normal? Do you have some abnormalities, not cancer? Do you have pre-cancer or do you have cancer? And if it's cancer, then it breaks down the cancer as well. What makes this test so awesome is because I think it's like the only test that could say 100% right now that can tell you cancer or the beginning of cancer long before, at least 5 to 10 years before it is
Wow.
actually cancer.
Okay.
So you do your pap smear regularly, which I encourage all women to have done. You do it, well, the US screening might be slightly different from Trinidad. So the Trinidad screening that I'm going to mention,
Mm-hmm.
please bear in mind,
Mm-hmm.
this is from when I was in Trinidad, which is 2009, 2010, 2010 to 11. So the screening could have changed, but I looked quickly on the Trinidad and Tobago Cancer Society and it seemed like it's still the same thing.
Okay.
So in Trinidad, the screening is basically 3 years after the onset of sexual activity or at the
Mm-hmm.
age of 21, whichever one comes first.
Okay, so
And
we start.
then,
So, Dr. Jackman, just slowing down a bit.
sorry, yeah.
So at 21 or 3 years after your sexual activity has started,
Yes, whichever
right?
one comes first. So if
Okay,
someone
good.
started to have sex at 14, they will be
Mm-hmm.
screened at 17. We will not
17,
wait for 21. Okay. And this is
right?
Trinidad guidelines. The US is very different.
Okay.
Um, so whichever one comes first. And then in Trinidad, I think it's still yearly screening. And if you had a couple of tests that were negative consecutively, then they can move on to two to
Mm-hmm.
3 years. In the US, because I see that we have some US people joining us. So in the US, our screening begins at 21. We no longer consider the age of sexual activity because we realize that young patients under the age of 25, usually, but particularly young patients, could clear HPV, which is the virus that typically causes this cancer.
Okay.
Young people immune is so good that even if we picked up anything, at 17 or 15, in 2 3 years they usually have nothing, no consequence out of it. So in the US we
Okay.
screen patients at the age of 21. There are some criteria if you have HIV or immune deficiency that we may start earlier, but generally it's at age 21. And if we had a couple negative screens, we move on to 3 year, every 3 years.
All right. Every
At an
three
older
years.
age, at 30, we can screen you with the pap smear as well as do an HPV test. And if
Mm-hmm.
that is negative, now we move on to 5 years. And
Okay.
that's because this virus, it works so slowly that it takes about 5 to 10 years and closer to the 10-year mark to develop cancer of the cervix, which is why I said in the beginning, this test is an excellent test because you have a lot of time to screen for it, pick up an abnormality, and like treat the abnormality long before you have cancer.
Okay.
So I encourage everyone listening today, please get your pap smear if you haven't.
Wow. Lovely. Great information. This is great. Yes. Okay. So that's going on my schedule, Dr. Jackman. Yes. And what about so many women, Dr. Jackman, even in my family, fibroids? Can
Oh,
you tell me about it in terms of what does it kind of affect infertility? Does it cause infertility? What other are the other areas of your health that it may affect?
so fibroids is extremely common, especially in the Caribbean, especially among people of African descent.
Yes.
So it's something that's very common in Trinidad. So
Mm-hmm.
fibroids are basically an overgrowth or growth of this muscular layer of the uterus. And it could grow on the surface of the uterus, it could grow in the muscle of the uterus, or it could go in the uterine cavity. Okay. And this is my example of a uterus. Sorry. This is the best I have, my fist. So depending on where the fibroid grows, how many fibroids you have, or how large your fibroids determines the symptoms and the effect of it.
Mm-hmm.
So, particularly people present with fibroids with two main symptoms, that's pain and heavy menstrual bleeding.
Okay.
Um, a lot of the times, unfortunately, most people have had this for a vast majority of their life, so they don't even realize it's abnormal. But
Mm-hmm.
excessive pain you should never have excessive pain. You shouldn't miss work because of your period. You shouldn't be doubling over and like crippled. And two things could cause this fibroids is one. Okay,
All right.
so a lot of people present for those two symptoms, but there are other symptoms. Some people have frequency, meaning that they go to the bathroom very often, and that's usually fibroids that press on their bladder. Some people present with constipation, likewise, the fibroid is pressing on their bowel. And other
Mm-hmm.
people present with infertility. It's controversial whether fibroids in itself causes infertility. More so, it's thought to cause problems with implantation, meaning you have the egg and the sperm meeting to form a little baby, a little zygote, an embryo. However,
Mm-hmm.
when it tries to implant in the uterus, the fibroid might prevent the implantation. So a lot of people with fibroids probably would more have recurrent pregnancy losses,
Okay.
miscarriages, stuff like that, as opposed to overall infertility, though some do have infertility.
Okay.
So depending, as I said, on where it's located, whether it's on that external surface, whether it's in the muscle itself, or whether it's in the cavity, will really determine what the symptoms would more likely to be. Um, Fibroids also have, some people would have absolutely no symptoms. Some people just get a scan for some other reason and they realize, oh, you have fibroids. So treatment really depends on what's bothering you and what the symptoms are. So for example, if somebody has fibroids but it's really not bothering them, do nothing at all, it's fine. They're
Okay.
not cancer, they're benign, so it's fine to live with fibroids all your life if it has no symptoms. If you're trying to get pregnant and you've done a complete workup, I would always say, if you're trying to get pregnant and you have fibroids, it doesn't mean that one plus one is two. So having
Mm.
fibroids and not being able to get pregnant doesn't mean it's being caused by the fibroids.
Right. Okay.
Anyone who has infertility, typically defined as 1 year of not getting pregnant after frequent sexual activity, at least 2 to 3 times a week without any form of contraception,
Mm-hmm.
should see a specialist to try and work them up as to why they're not getting pregnant. Because you may have fibroids, but it may be something more that's causing the infertility. But if it's deemed to be
Okay.
fibroids only, then removing the fibroids may definitely assist in getting pregnant. If you have heavy pain, I mean, a lot of pain or heavy bleeding, then we could start off with medical treatment. Depending on how bad it is, we can start off with just giving you painkillers like Motrin, or we can give you birth control pills to regulate your periods. And then we kind of work our way up to surgical management. So the
Okay.
management starts off as do nothing, medical management. We have like miniature procedures where we can
Mm-hmm.
like put beads to basically starve the fibroid from the blood supply, and that's done with a special
Okay.
radiologist. And then we have surgical management. So that just depends on where you fit on the spectrum. And usually a
Wow.
gynecologist, your
Okay.
general
Lovely.
gynecologist could do the initial workup. And if you more seek infertility aspect, then you'd probably want to see a reproductive endocrinologist.
Okay. Great. So you said when you was describing everything, you said that you may have painful periods and that there may be two reasons. One
Yeah.
you said would have been the fibroids. Can you tell us what the other one may be?
The second one is also very common amongst people in the Caribbean is endometriosis.
Okay.
So the lining, the inside of your uterus, and that's the part that every month sheds if you don't get pregnant, that's called the endometrium. When this
Mm-hmm.
tissue is found outside of the cavity of the uterus, it's called endometriosis. So it's basically this tissue that's supposed to be inside of the womb being found
Oh,
outside of the womb. Some people have it on their bladder, some people have it on their bowel, and some people just have it in their pelvis, inside their pelvic cavity,
okay.
not confined to the womb. The problem with this tissue being everywhere else is that it responds to hormone the exact same way or similar way that your uterus responds to hormone every month. So every month, your uterine cavity inside your uterus grows. If you don't
Mm-hmm.
get pregnant, it sheds, and you have that period where you bleed. Now imagine if that's happening inside your pelvis. There is no outlet for you to bleed
Mm,
out of your pelvic cavity or your abdominal cavity.
mm-hmm.
So it grows and it bleeds, but it has no outlet. So you just get severe pain.
Wow,
In
okay.
addition to the pain, blood inside your body with no outlet, it becomes, I would say, sticky. Think of like any sort of blood when it's there for a while, it
Mm-hmm.
clots, right? And
Yes.
this causes different body parts to stick together. So it's called adhesions. So your bowel could be stuck to your bladder, could be stuck to your uterus. Everything kind of becomes like a matted lump. Like if you just pour cement over everything and let it dry.
Try. Mm-hmm.
So patients could experience severe pain, and endometriosis pain sometimes is even more severe than what is described for fibroids.
Mm-hmm.
And there's actually a strong correlation in studies done by Dr. Cameron Najat. He's like a leading expert on endometriosis. And there's studies where he actually correlates that a lot of people who have fibroids and attribute their pains to fibroids actually also concurrently have endometriosis, unfortunately. It's a very high
Okay.
percentage, at least over 80% of people he has found in his studies. So, with endometriosis, with everything being stuck together, you get severe pain, like
Mm-hmm.
really severe pain. They definitely have infertility, and there's a high percentage of endometriosis found in patients who are infertile. So it
Wow.
goes back and forth the same way. So they have pain, they have heavy bleeding, they have infertility, and unfortunately, because I said it could be found almost anywhere inside your abdominal pelvis, depending on where it's found, could produce symptoms. So you can have bladder irritation, you can have diarrhea as well as constipation, and it could fluctuate. You could have chest symptoms if it's found higher up, like under the diaphragm. So this is like
Mm,
really pesky tissue that can literally go anywhere, and it's also very difficult to treat. It's not as, I would say fibroid surgery is probably simpler because a fibroid is a more obvious entity, whereas
mm-hmm.
many people, including gynecologists, will could miss endometriosis because it looks different in different people.
Wow.
So
Okay.
yes.
So how is that diagnosed?
So as it stands now, the only way to 100% diagnose it would be through surgery. As in, we can take a tiny a camera and do keyhole surgery, what we call keyhole surgery. We take a
Mm-hmm.
camera called a laparoscope and we look inside the abdomen and pelvis and we see if we literally see those deposits. The
Oh,
problem
okay.
with that is that that test is as good as the person who's doing it. It's not like a, something that you can send to a lab and get a yes, no, or a value. So somebody who has done a lot of surgery in endometriosis and knows the different way it presents and looks will be able to diagnose it much better than somebody who does this once, every couple of weeks or months or
Mm-hmm.
whatever. So I always strongly suggest to patients that if they think they have endometriosis, if they think that they are experiencing really severe pain, and they go through criteria and they realize maybe this is maybe endometriosis, you want to be evaluated by someone. Your initial evaluation could definitely be done by your gynecologist, but I
Okay.
always suggest getting treatment by someone who has done large volumes of endometriosis surgery and treatment, because you'll be best in their hands. Because, as I said, it could present a lot of different ways. I'm
Mm-hmm.
actually trying to look at my phone for an app because, it's called Najat Endometriosis app, and I could I don't know if you see it from here. It's this one. Oh, nope, not that one. Sorry for my slight clumsiness. This one, Nezhat. So Nejat Endometriosis. It's actually an app that you can download. There's a lot of questions. You can do the questions, and it will give
Okay.
you a percentage of how likely you are to have endometriosis. So it's
Okay.
pretty good. So, there are a lot of doctors right now who are trying to develop ways that we don't have to rely on just surgery to diagnose endometriosis.
Mm-hmm.
It's new, it's up and coming, but I definitely think that it'll be worthwhile if we do get different forms. But currently, the gold standard to diagnose endometriosis is laparoscopic surgery to see if we see it, and you can also do treatment at the same time. But make sure you
Okay.
have a really good laparoscopic surgeon who has done a lot of endometriosis surgery.
Okay. That is the key.
Yes.
Yes. And so out of all of that we have spoken about thus far, I want to get speak now about the whole issue of infertility.
Okay. My passion.
Um, yes, I know that's your baby.
Yes.
So it's your passion. In terms of getting families, women to to that place where they get with what they desire, which is to have children.
Right.
And what are some of the causes, apart from what you would have discussed previously, that some of the ways that women may be infertile or would have caused them to be infertile?
Well, infertility, and this is a US definition. I apologize. I don't know what the percentage is in Trinidad. At least 15% of couples, at least in the US, are thought to be infertile. And that number is it's probably an inaccurate number because many people don't feel comfortable speaking about infertility. And this is
Yes.
true worldwide. Women tend to
Right.
feel responsible for infertility,
Yes.
but infertility is really a couple's issue, not an individual issue. If I can't
Mm-hmm.
get pregnant, we can't get pregnant. Even it doesn't matter who the problem is. The point is,
Mm-hmm.
we as a couple can't get pregnant, so it's our problem, not mine or yours.
Right.
And you have to realize a lot of times we forget the men in infertility or in reproduction in general. And the men contribute 50%. They're very,
Right.
very responsible as well.
Right.
So when you talk of infertility, you have to realize that there are male factors, there
Right.
are female factors, and there's combination factors.
Mm-hmm.
And then there's some people that we would never be able to really tell based on our ability to diagnose at this point in time. Maybe 5 years from now, we'll be able to get it. So when we look at male factors, it's much simpler. It's if something's wrong with the sperm or not. Okay. Several things could go wrong with the sperm, but it's just about the sperm, more or less.
Right. Right.
And once the men provide the sperm and provide a sufficient amount of good, healthy sperm, that's their issue there. For women,
Right.
it's much more complex because we are not only having to provide the egg, which is the equivalent of the sperm, but we also have to provide the tunnel or the channel for the egg to reach inside the uterus. We have to
Mm-hmm.
provide the uterus, which is going to be the nesting ground for this growing embryo for 9 months. And we have to
Mm-hmm.
provide the hormones to have all this rolling and to keep this sustained. And then we have to provide the outlet with the cervix and the vagina to get this baby out. So we tend to carry more of the weight because we contribute a lot more subsequent to getting pregnant. So what could
Yes.
go wrong? It can be something wrong with the brain because the brain have to signal all of these things for it to happen. And I'm just simplistically giving categories. It can be something wrong with the ovary. Either the ovary is not producing eggs, not producing
Mm-hmm.
enough eggs. the eggs are not good quality, or the eggs are not being released or ovulated. So, for example, a very good example that we didn't touch on as yet is polycystic ovarian syndrome, also very
Right.
common in the Caribbean.
Yes.
Um, they have a lot of eggs. Number of eggs is not their problem. They just really
Mm-hmm.
don't ovulate. And ovulate means to release that egg. And because they're not releasing the egg is as good as none, because it needs to get out of the ovary to get into the tube, to meet the sperm, to get into the uterus. So if it's stuck in the ovary, it could be the best egg, it could be the worst egg. It doesn't make a difference.
Right.
So polycystic ovarian syndrome is one example of that. Then it could be something wrong with the tubes. So a lot of patients who have had previous sexually transmitted diseases, particularly gonorrhea, chlamydia, we classify this under pelvic inflammatory disease, PID. They get a lot of adhesions. The adhesions, like what I spoke about with endometriosis, is very similar. And it really affects the tubes a lot, and it could scar inside the tube. So therefore, there's no, it's like if you have an accident inside of a tunnel, nothing's going in, nothing's going out. So, endometriosis could also block the tubes and cause problem with the tubes. Then you can have a problem with
Not hearing. I don't know if it's just me. Dr. Jackman? We seem to have lost her there. We seem to have lost her there, guys. Okay, she will return shortly. Do not miss our conversation. We are now getting into the meat of the matter. Don't miss it. All right. I'm seeing Jiz is here. Doctor is frozen. Okay, thank you, Quema. Her camera seems to be stuck. Okay, she's back.
I'm
So let me.
sorry, yes.
All
And
right, Dr. Jackman.
yeah, I think that was my internet, but I'm going to
Yeah, she's still frozen. Okay, doctor, I'm seeing you. Still. All right. Thank you, Queba. Okay, so we're back.
yes, I'm sorry. I'm going to use my phone now.
Okay, lovely. So we're hearing, everyone is hearing. Ladies, send me some feedback. Doctor, we have there is a young lady, Jiz L. She said, hi, Dr. J. You're
Hi,
looking
Giselle.
lovely.
Thank
She said,
you.
looking beautiful, looking beautiful. All right. I'm okay. I am It's me. Right. Okay. Yes. So we are back.
Yes, I switched to my phone. I think my internet is acting up a little bit, so I'm using my
Okay.
phone. Yes. I'm sorry, I don't know where you heard up to. But,
I heard you were speaking about the tunnel. You said there
right.
are issues, right?
And then the last issue that I had mentioned after that was just there could be issues with the uterus, where I mentioned
Right.
fibroids before. There could be a problem with the shape of the uterus or the lining of the uterus not being thick enough for the embryo to be rooted in, similar to a plant, not being able to take roots in thin soil. The same thing happens with the embryo, the endometrium.
Okay.
Yeah.
Right.
So there's several different reasons, several different factors. The more popular thing that we experience in the Caribbean is pelvic inflammatory disease, which I said is caused by previous STD, endometriosis, polycystic ovarian syndrome, and fibroids.
Okay.
That tends to be, what's more common.
All right. And so, Dr. Jackman, for family, as you said, it's not only the woman.
Yes.
For a family that is dealing with infertility, you may have experience meeting with different clients. What are some of the things you think? I know you are an OBGYN, but over a period of time, there were some things that I'm sure you would have observed that would have assisted families in this journey.
Yes. Well, I am an OBGYN, but I did work in a fertility center. I've been working in a fertility center for the past
Right.
year. So one thing I just want to initially do is define infertility. Because if you don't know the definition, you don't realize that you are probably suffering from infertility.
Okay.
So infertility is the inability to get pregnant after 1 year of actively trying, meaning unprotected sexual activity without any form of contraception. So no condoms, no birth control pills, no IUDs, no patches,
Right.
nothing. The 1 year definition tends to be the general definition. However, at different age groups, you can seek treatment without waiting 1 year, or if you have special conditions. So if you've had previous surgery on, let's say, your ovaries, or you know that you have endometriosis really bad, then you can actually present at like a 6 months. You don't have to wait the year. The
Okay.
1 year definition is usually for people under 35 years. If
Right.
you're between 35 to 40, 6 months works for you. If you're 40 and trying to get pregnant, you don't even need to like wait till you're not getting pregnant. You can seek help at 40 right off the bat
Okay.
without even trying.
All right.
So this is the definition of infertility. So for people who are experiencing infertility, and I'm sure there are a lot of you right now who realize that by 1 year definition, you're like, oh, we've been trying for 2 years, 3 years, 5 years. Because
Right.
I hardly have anybody who presents to me for trying after 1 year. Like that's very
Right.
rare. Most patients come and it's 3, 5, 10, 15, and I'm like, wow, the OBGYN never said anything. So the important thing is that if you've been trying for considerable amounts of time and you have not been getting pregnant, you should seek help and know that there is help. You can start off with your gynecologist who can do basic workup, and sometimes the answer is much easier. For example, if it's fibroid, your gynecologist might be able to do the surgery, and that may be able to rectify the issue.
Good.
However, if it's something more complex, more extensive, then you may want to go to a reproductive endocrinologist. In Trinidad, there's Dr. Minto Bain. She is the only reproductive endocrinologist, as far as I know, in Trinidad. But also, there's a gynecologist who works very, very closely in Trinidad with the Barbados Fertility Center, and that's Dr. Prakash Prasad.
Okay.
So there are two options.
Doctor, can you repeat the names, please, for the viewers, right?
So Dr. Minto Bain with IVF Trinidad.
Right.
I think there's 3 locations. One in Central, one in like Maracas, St. Joseph area, and one in Rokrino. I think that's Marval. So that's Dr. Minto Bain.
Good.
Then there's also and you'll be able to get everything done in Trinidad with Dr. Minto Bain. And then there's also Dr. Prakash Prasad, and he works with the Barbados Fertility Center. I'm not too sure if that's the exact right name, but he works with the Barbados Fertility. I think that's the name. And you will be able to get a lot of workup with him, but ultimately you would have to go to Barbados to get the procedures done. So there are 2 main options in Trinidad. One is all in Trinidad, and one you'd have to toggle between Trinidad and Barbados, but there are options. So a lot of people don't even know that we have the options available. We actually do.
Right.
And based on your comfort level with the providers and the locations, you can decide which one you prefer to go to.
Lovely.
So
Lovely,
different help
lovely, lovely.
if you have experience in fertility.
This is great. And so, doctor, this is my final question. Well, almost. There is a woman looking on now, and maybe she's saying 2020 is her year to try.
Take the year.
What is your advice?
That's a very general question, whether to try or not, or is this in relation to coronavirus?
To corona, and what should someone do in preparation
So, if you
to
want
becoming pregnant?
that's a good question. Excellent question. So, to prepare to become pregnant, you should think of your overall health. You have way better chances of becoming pregnant if you're healthy, and that's you and your partner. Remember, I said it's a couples thing, right?
Right.
So you want to make sure that you have a good diet, that you're exercising at least 3 times a week over 30 minutes, about 30 minutes minimum. That if you're a smoker, that you stop smoking. I'm not saying cutting down, I'm saying stop altogether. Smoking, actually, there's small little tiny hairs in your fallopian tube that helps move the egg and then the subsequent embryo if it's fertilized from the fallopian tube into the uterus. And
Wow.
smoking could actually paralyze, like cause these hairs to not move. So your egg gets stuck in the fallopian tube and you can develop something called an ectopic pregnancy. So
Oh.
smoking is not good for many factors, a lot of cancers, and we know of
Mm-hmm.
them. But
Mm-hmm.
in addition to it, if you're trying to seek fertility, smoking is horrible for fertility. It can also decrease your eggs, it can decrease your sperm. It's horrible for fertility. Unfortunately, drinking is as well. So you want to cut down. You don't have to cut out completely, but if you drink excessively,
Mm-hmm.
and we're not talking about social drinking, we're talking about if you drink like you have to drink every day, or you have to drink. I mean, the amount you drink is excessive. Or even if you're drinking like once a week, because some people don't realize they may be drinking once a week, but in that once a week they're binge drinking, like drinking a
Mm-hmm.
lot. That's also bad. So with
Okay.
the drinking aspect, you could cut down. You also want to make sure, as I said, you're overall healthy. So if you have any other medical conditions, diabetes, high blood pressure, sickle cell, any of these things, you want it under control before you try to get pregnant. Diabetes and
Right.
high blood pressure also are not good combinations for pregnancy.
Right.
Lastly, every single woman of reproductive age group, meaning generally from the beginning of your menstrual cycle until you stop getting your menstrual cycle, meaning from menses
The
to menopause,
menopause.
should be on folic acid. And that's because folic acid prevents a certain defect in the spine in youth and fetuses. So we encourage people to be on folic acid, and in general, you can take a multivitamin which will have folic acid, and
Okay.
that will also help. So these are some of the things you can start doing when you're preparing to get pregnant. Then when
Right.
you're actually trying to get pregnant now, a lot
Mm-hmm.
of things will be helpful, like knowing your menstrual cycle. And you should do that from the minute you start getting your periods. Know your menstrual cycle.
Mm-hmm.
There's a lot of apps. There's Period Tracker, there's Flow, and many other apps that you can actually just log when you get your period the first day. It can log symptoms and you can log when your period ends. And it's good to know what your cycle is. Are you every 28 days? Are you 30 days? Are you irregular? So that helps because you can actually try to time having sex based on your period. So
Right.
generally, as a typical rule for people who ovulate and people who have regular cycles, 2 weeks before your period begins is generally around the time that you're going to ovulate, which is to release the egg.
Mm-hmm.
So therefore, you want to have sex before the egg is released because we want the sperm to be there before typically. People
Okay.
usually have sex after they ovulate, and the window is very small because it takes a while for the sperm to reach to where it's supposed to be, and the egg survives less than 24 hours. Sperm
Okay.
can last 5 days. So if you have sex about 4 to 6 days before you think you're going to ovulate based on your prediction of 2 weeks
Mm-hmm.
before you bleed,
Mm-hmm.
the perfect time to have sex 4 to 6 days before, and then every 2 days into 2 days after you ovulate. This will increase your chances of being able. This is your fertile window that we all speak about, and this
Right.
increases your chances. If you want to be a little more accurate as opposed to using time, you can take ovulation prediction tests. It's a kit that will tell you when the hormone level that goes up for ovulation goes up, and it will be like, oh, you're gonna ovulate soon. Start having sex, okay? This kit is better used like if you know you do the kit like 1 or 2 cycles and you're pretty regular and you know when you're going to ovulate. Then for subsequent cycles, then you can have sex 6 days before. But when you're actually using the kit, by the time you get that hormone rise, you should have had sex already, right? So also when you miss your period is late and you usually have regular periods, you want to present to your doctor earlier than later. You want to take a home
Right.
pregnancy test earlier than later. Because lots of times I have women present and they're so far in their pregnancy and we've missed a lot of screening opportunities, a lot of educational opportunities, a lot of health opportunities.
Mm-hmm.
So when you miss a period, earlier is better than later to know. And even if God forbid you're not pregnant, it's also better to know earlier than you're thinking that you are, right? So
Right.
these are some of the basic things that we can do as women when trying to get pregnant,
Hmm.
before trying to get pregnant, and also when we're actively trying to get pregnant. And if you're already past a year of trying and consistently trying, then I mean, you can do all of these things, but in addition, seek help. Huh? Don't
Good.
do all these things and delay. Because as women, as we get older, our eggs get older. We're
Yes.
born with all our eggs. So the
Hmm.
quality decreases and the amount decreases, and we don't want to lose our fertile period. So
Right.
women, we have clock, and we need to act sooner than later.
Good. And there's a question, Dr. Jackman. Any advice for someone who had an ectopic pregnancy that still wants to get pregnant?
If the person is still on, I'd be like, how did they treat the ectopic pregnancy? So an ectopic pregnancy is a pregnancy that's not in the right place. The right place is inside the cavity of the uterus, of the womb. And an ectopic pregnancy is any pregnancy occurring outside of that usual location. Most commonly, an ectopic pregnancy, and this is probably what she's referring to, it happens in the tubes, the fallopian
Hmm.
tubes. The fallopian tubes is the worst place, one of the worst places for a pregnancy to grow because it doesn't have that thick muscular layer to expand with the pregnancy. It doesn't have a good blood supply. And eventually, as the pregnancy gets more advanced, it will rupture, leading to bleeding, and the patient herself could die. So we
Okay.
take ectopic pregnancies very seriously. So
Hmm.
if the patient, and she probably did, had an ectopic pregnancy that was treated with surgery, meaning that they removed that tube, if her other tube is still there and is still open, by all means, she can still try getting pregnant.
Okay.
The whole reproductive system fits into your pelvis and it's like about yay big when you're not pregnant. It's very small.
Hmm.
So even with one tube, let's say you had a right side, your right tube was removed. Even with your left tube being open and working well, the egg could come from the right side and still enter the left tube. It's fine. So the
Okay.
tube that's open doesn't have to be the tube, the side that the egg is being released from. The whole
Hmm.
system is small, and the egg has a way to basically find the tube, right? So it will find any tube, and if the only one you have is the left, that right egg will find it. So, however, this is only if you have a tube still, and if you know for sure that your tube is open and working.
Okay.
If, let's say, God forbid, you had two ectopics in both tubes, so both tubes are gone, or if you know off the bat that the tube is not working, then you still have options. And your
Hmm.
options include IVF, which is a way that we can help stimulate the growing of your eggs. We actually take them out of your body through a miniature surgical egg retrieval, and we fertilize it out your body, and then we put it back through the vagina, through the cervix, into your uterus. From what I said, you realize we didn't need the tubes at all because we took it
Hmm.
directly from the ovary,
Hmm.
fertilized it outside, and put it back through the vagina into
Right.
the uterus. So for people who don't have tubes, IVF is usually a really good option, especially if nothing else is wrong.
Hmm.
IVF is a good option to help get pregnant because we bypass the tubes. And lastly, let's just say for whatever reason, let's say you have no ovaries on top of this. I'm just creating scenarios right now to
Hmm.
speak to as many people who may have different scenarios. If God forbid something is wrong with your ovaries or you haven't been able to produce, you've tried IVF and you haven't been able to produce, proper embryos, you can also, and this one is a little more uncomfortable for most people, you can also use donated eggs or donated sperm, depending on what the problem is. There
Okay.
are also donated embryos, meaning somebody else complete embryo. That person wasn't comfortable discarding the embryo, she didn't want it, and now donating it, to someone else to have the possibility to have a baby. And
Hmm.
lastly, there's always adoption. There are
Right.
many babies, lovely babies being born, and unfortunately, for whatever reason, their parents cannot take care of them the right way, and they're waiting for parents like all of you who are listening out. Anybody who's seeking fertility treatment and going through all this effort will simply love a child beyond the child, beyond you can imagine, and will take really good care and be an excellent parent, whether you got pregnant the natural way, with IVF, with IUI, which is us putting sperm inside, with donated eggs or sperm, donated embryos,
Hmm.
or uh, adopted baby. You don't have to justify and explain how you became a mother. The joy and the ability to be a mother or father or parent is within itself. You don't have to justify to people how this happened. So don't feel bad if you had to try different means to accomplish your
Right.
goals. This is all about my persistence and positive thinking.
Mm-hmm.
We all have different ways to get to the same place. I can go to Tobago on an airplane, you may take a boat, but the end point is that we both reach to Tobago. So
Lovely.
don't, be bogged down by the how. Just once you arrive to your destination, that's all you need to do.
This is lovely, lovely, lovely. Great. A great way to end our conversation. And Dr. Jackman just came home from work, or she just came in from work, she said. Dr. Jackman looks so lovely going to work.
I
Love that
actually,
dress.
I actually quickly like had to refresh my makeup and stuff. I told my colleagues I was in the OR whole day today, and I was like, guys, I have to leave on time. I have to leave on time because we usually eat after
Right. Okay.
together after the OR, and I was like, no, I have to be out there.
Thank you so much for the sacrifice, Dr. Jackman. We really appreciate it.
No
And
problem.
Giselle says, let the church say amen. I guess when you spoke about the positive thinking.
Yes. If there's anything I want to leave you guys with, is the power of positive thinking. Trust me, what you believe and what you project and what you think is what you get more of. So think of like the universe as a mirror. What you put out into it is what's going to be reflected back to you. People who think more negatively get more negative results. People who think more positively get more positive results. And I'm a
Yes.
walking testament to that. I believe things are going to happen, and it happens. And when it doesn't happen, it's because something better is going to happen. So
Very good.
I'm always like, yeah, I don't worry and stress about most things because it's like, something's good gonna happen either which way.
Wow, wonderful. That is a great note to leave our conversation. And once again, thank you. People are saying so much knowledge, um, great advice. Safia says you're a blessing, Dr. Jackman.
Thank you.
Thank you so much for taking your time to spend with us this evening. We know you had a very long day and you're probably tired. Thank you. God bless you.
I just want to leave with you can follow me on Instagram. This is where I do
Right.
most of my educational videos and series. I'm currently doing one talking about egg freezing, which is a taboo
Okay.
topic. And my Instagram is Janelle M Jackman MD. Janelle Janelle Jackman MD, and you will find me. And on YouTube, I'm just Janelle Jackman, no M, Janelle Jackman MD. So
Okay.
I do educational videos, I do educational posts on Instagram. And if you have any questions or anything specifically you want me to discuss, I can't give specific individual medical advice on Instagram and YouTube.
Right.
Medically legally advised because I can't examine you and get to the minutia of your history. But I
Right.
definitely can talk of global topics like how we did today. So you have PCOS, you want to learn more about PCOS, we can discuss PCOS in general and different options, etc. So follow
Yes.
me, Janelle M. Jackman, MD, Instagram and YouTube.
I'll be sure to add all the links in the description so they will see them. Okay, Dr. Jackman?
Yes, thank you so much.
All
It
right. Okay. So
was a pleasure.
good evening and thank you so much again.
No problem. Let's roll.
Yes, let's
And
roll.
I have my lion painting in the background.
Oh, lovely. Lovely. Okay,
All
blessings.
right. Have a good day. Bye bye.
Same to you. Bye. Bye, ladies. Thank you for joining Dr. Jackman and I. So that's the end of our conversation. I hope that you all would have learned something and that you share this video. There are so many women who may be suffering in silence, as I say. So share this video, like it so that someone would learn, and I will be sure to include all the links Dr. Jackman spoke of so that you can follow her. She's a Trini living in the US, living and working in the US, trained in Trinidad as well as the US. So she has, I think, the best of both worlds for us, and we can learn so much. So once again, thank you for joining Women Who Roar with La Femme Boutique. Our new collection is coming very soon. It's coming very, very, very soon. And this collection is called the Phoenix Collection. So stay tuned, guys. It's a beaut. Listen to me. Mm-mm-mm. Wow. This collection, yeah, it's beautiful. Trust me, you don't want to miss it. So you'll hear more about it soon. Thank you for spending your evening with me. I'm seeing Quema. Quema said, thank you, Dr. Jackman. Safia, thank you, Stacy. Stacy is on. Blessings, guys. Love you guys so much. Patricia, I said Pat Pierre is on. Chinara was on. Melissa was on. Thank you. Thank you. So blessings and bye. Have a great evening.